Now to the story that's new at 6, tackling racism as a public health crisis in Milwaukee County. Officials are looking into how combining the health departments into one county entity could go a long way towards a more equitable region. Sean Gallagher reports.
It's been almost 2 years since the county named racism a public health crisis, and now they're trying to bring experts from all over the county to the table to try and defeat it.
You can't think of health without thinking of equity as well.
Health officials in our area are looking at what new strategies they can implement to tackle racism as a public health crisis. While there are other county health departments all around the state, Milwaukee County does not have a centralized health department.
There's so much work that still needs to happen. We are just researching and then looking into those recommendations of how do we move forward.
Shakita LeGrant, director of the county's Department of Health and Human Services, says the plan to establish a countywide health department is in the very early stages, so it's hard to say what it could look like. But she says there's a clear need. According to the University of Wisconsin School of Medicine and Public Health, Milwaukee County is the second least healthy in the state.
County executive really pushing towards that vision of, through racial equity, Milwaukee will become the healthiest county in Wisconsin. That is not going to happen overnight. We need to make sure that we really are looking through that racial and health equity lens in all the decisions that we make, and also making sure we have the resources to do that.
Right now, there are 11 health departments in the county, covering various municipalities. In total, they serve nearly 1 million people. It's still to be determined, but Cassandra Liebel with the Office of Emergency Management imagines there will always be some type of local health entity. A countywide health department, she says, could streamline things.
We want to make sure that we're continuing to work with them. But yeah, it's just collaborative efforts. It's a way for us to make sure that we're not being redundant in different communities, sharing resources, and really just maybe highlighting areas of concern that may be missed when that lack of communication isn't there.
Through research, Milwaukee County will look at 4 to 6 other counties comparable to Milwaukee to see if they have strategies we could implement here. Ultimately, the County Board of Supervisors would need to formally vote to establish a countywide health department.
We're going to have to figure out how we come together and really make this work so that we, again, can address some of those underlying, those root causes that people are experiencing, mental health, and again, the housing, the employment, the transport, all of those things that are impacting people. Like, we need to figure it out.
The goal in the end is to improve health, and we know how closely equity is tied to health.
They expect to finish their research on this topic over the next 6 months to figure out if this is the best option going forward. In Milwaukee, Sean Gallagher, TMJ4 News.